And it's Wednesday, so that means we're being joined by Dr. Brian Richardson. He's going to be taking your healthcare questions in just a moment. But first, we're going to talk about a health-related issue. Dr. Richardson, thanks for being here.
Good morning.
As
Merry
always.
Christmas.
Merry Christmas to you. Wanted to talk about how life expectancy has gone down, not significantly, but just a little bit recently. There's a new study that came out, right?
Yeah, so first time since 1993, the actually life expectancy from 2014 to 2015 dropped by 1/10 of 1 year. So not a huge
So you
change.
lose a month of your life
Right.
or something? Okay.
Yeah, and that doesn't seem significant, but I think in the big scheme of things, when you look at the fact that it didn't happen in Europe, it didn't happen in some of the Asian countries, and the bigger point is that it actually hasn't happened in the U.S. in over 20 years.
Right, which is a significant amount of time, you know, because I know it kept going up and up and up, and now it's the first time that it's dropped.
We've kind of
at all.
flatlined on our life expectancy, and so seeing that the first drop was, it rose some eyebrows to say, is this a trend? It's not yet a trend since it's only 1 year.
Right, only 1 year.
But it's you know, it brings to attention the fact that why are we not living longer?
Absolutely. So what was some of that attributed to?
Well, the biggest one was always heart disease, and it remains heart disease. Interestingly, though, cancer-related death, which is number 2, actually dropped by about 1.7%. The reason for that may be some of the new medications. I think more personally, I think it's because less people are smoking tobacco. Okay, so you know, we can see the tobacco usage in the United States. There's a big
the carcinogens, I guess, that are in the tobacco. Okay.
Otherwise, what we did see was a big rise in suicide, drug overdoses, and accidental deaths. And I think there's been some mental health issues that's been highlighted here in Montgomery. It's been highlighted throughout the country, is that maybe we don't have a good enough system that's being able to take care of our patients who have mental health issues.
Some of those suicides and things along those lines, could you attribute some of those to maybe the advances in technology, social media, things like that?
Yeah, well, some people are postulating that maybe it's due to the economic downturn, right? So things aren't as good. Maybe you don't have a good job, you're not making as much money, and so you start feeling bad about yourself, and then you turn to drugs, or you know, you just don't have the social support that should be there.
Well, talking about heart disease, there's a lot of ways to prevent heart disease.
Right.
What are some of those?
So I think that one thing that we can know for sure is that if we see that the life expectancy is going down, on the opposite side we see that the obesity rate is going up. And so I think if people take a stand back and look to see, well, you know, can we explain life expectancy dropping? Well, I think one of the things is lifestyle, because medications are good, surgeries are good. We have new medications and new surgeries and new techniques, new diagnostic testing, but it's like I can't be at your house all the time saying you must eat this and you need to go exercise.
Right.
And
you got to keep yourself accountable.
That's right. So, and a lot of people don't, you know, they want to go to the doctor and say, fix me. You know, how can I take this medication? It's a lot easier to take a pill than it is to choose wisely what you're eating and what you're drinking, as well as how often you get out and actually doing some exercise.
And so much of that starts in the kitchen.
It does. It does start in the kitchen.
Healthy foods. All right, Dr. Richardson, thank you so much. We'll take your healthcare questions here coming up in just a moment. You'll be taking your calls. The number to call is 1-800-504-4084 or 420-TALK. We'll be right back.